Good evening, friends. I'm Dr. Ajay Shah. I'm restarting this Facebook Live. I've taken about 6 months off, and I'm fully recharged, and I'm ready to start having some education, some learning, some working together, growing together, staying healthy and living longer. So today's topic, I picked a topic which is very important, and today's topic is high blood pressure. I'm sure all of you are aware what is high blood pressure. High blood pressure actually is one of the most preventable cause of death in the world. Again, high blood pressure is one of the most common cause of preventable death in the world. So very important, all of you know should know your blood pressure. Very important. Please comment, please ask questions as we go through this 5 minute live today. I will be doing high blood pressure 5 minute segments over next 10 days. So again, high blood pressure is very common. It's as common as 50% of Americans. Many people think that as we get older, high blood pressure becomes common, but that's not true. Many people who are healthy, people particularly who are into rural Africa, they don't have high blood pressure as they get older. So not necessarily age brings the high blood pressure. So what is high blood pressure? High blood pressure means having blood pressure above 120 over 80. We used to think blood pressure of 140 is normal, but now with the new data, we know that the blood pressure above 120 leads to many complications. So I want all of you to have your blood pressure below 120. 120 to 130 is considered elevated blood pressure. 130 to 140 is stage 1 blood pressure. 140 to 160 is stage 2 blood pressure. And 160 or above systolic blood pressure is blood pressure urgency. So if your blood pressure is above 160, you need to seek medical attention right away. You should call your doctor as soon as you can if your blood pressure is above 160. Over the next few days, we will cover how to measure your blood pressure, how to treat your blood pressure with medications, and also how to lower your blood pressure with some natural things, including losing weight, including many other things. So we will be covering many topics on how to treat high blood pressure. High blood pressure is very common in certain ethnic population, particularly African Americans, even Indians, even Hispanics. So we need to be making sure the blood pressure gets checked in a certain ethnic population. We know now that the blood pressure lower the better, and actually blood pressure of 110 or below is my target in my patients. I try to keep my blood pressure below 110. I used to have a high blood pressure. I've lost significant amount of weight, as you many of you know, and now actually my blood pressure runs anywhere from 105 to 115 range. So again, you can lower your blood pressure just by lifestyle changes, which we will cover over the next few days. Uh, so high blood pressure again is considered silent killer because when you have a high blood pressure, most people are asymptomatic. That means they don't have any symptoms. Again, high blood pressure doesn't hurt. High blood pressure does not give you any symptoms or many time any kind of issues. So you actually can go on many years having high blood pressure and not even know about it. And that's the reason I highly recommend every person above age 20 to consider having a blood pressure machine at home. Blood pressure machine now are only about $35-40. You can buy it at any pharmacy, you can buy it at any grocery store, and actually you can measure your blood pressure at home without any issues at all. So I highly recommend to buy a blood pressure machine and actually start taking your blood pressure at least once a week. If your blood pressure is below 120 over 80, you can take it once a week, even once a month. If your blood pressure is above 120 over 80, start taking blood pressure every day and report to your physician if it persistently stays above 120 over 80. So what are some of the common reasons for having high blood pressure? obesity and being overweight is one of the most common reason for having high blood pressure. We will go over through how you can reverse your blood pressure with natural things, including lifestyle changes over the next few days. But obesity and overweight is one of the most common reason. Alcohol is another common reason. Having caffeine intake is another common reason. Poor sleep, sedentary lifestyle is another common reason. There are certain secondary causes of high blood pressure, which we will cover over next few days. But one of the common one is having certain adrenal gland issue, thyroid gland issue, having low thyroid, sleep apnea, and many other conditions. Eating processed food also make you have high blood pressure. Poor intake of vegetables and fruits also will predispose you to having high blood pressure. Uh, so again, there are many reasons for having high blood pressure. We used to call high blood pressure an essential hypertension, which in my opinion is a wrong terminology to use. There is nothing essential about having high blood pressure. Any high blood pressure is abnormal. There is nothing essential about it. So if you have a high blood pressure, make sure you know it, make sure you diagnose it, make sure you seek medical attention through your doctor, and make sure you bring it down below 120 over 80, preferably below 110 over 80. Again, today's segment was about how common the blood pressure is, what causes it, and what you should reach out for. Tomorrow, we will cover how to measure your blood pressure, how you can do it at home, how you do it at doctor's office, and how you can make sure that the blood pressure measurements are accurate. This video will be on YouTube, so you can watch it on YouTube. Please have your comments and questions today, and please share this video. I will answer all the questions you have today, tomorrow live around same time, around 9 o'clock tomorrow evening. I'm hoping to do 5 to 10 minute live every night. As I understand, a lot of people are busy and having long lives, 30 minutes, 60-minute long, people don't have time. So most of my live now are going to be 5 to 10 minute long. So you can quickly watch it, quickly learn, and start implementing from next day. Again, this will be on YouTube tonight, so you can watch it again and again. Tomorrow will be segment 2 of high blood pressure. We will be covering high blood pressure in 10 segments over next 10 days. I have multiple topics lined up, including how to lose weight, including obesity, including thyroid issues, including Alzheimer's disease, including heart disease, including cholesterol, and we will be covering all those topics in 5 to 10 minute segments over next 1 year. So I welcome all of you back to our Facebook Live. Please share this video. Please stay healthy. Please eat healthy, exercise, sleep well, and we will see you tomorrow evening. Thank you again and have a great night. Thank you.